Welcome to the Stronger After Stroke podcast. I'm your host, Rosa Hart, the stroke nurse navigator for Norton Healthcare. Today, I have a special guest, Dr. Sarika Chandiramani. She is one of our pulmonary specialists, which may not be your first thought when you think of stroke, but thank you for taking your time to be with us today.
I'm glad to be here. Excited to talk with you about this.
So I know you work with a lot of my stroke patients in the hospital as well as in the clinic, right?
Yes, I do. I do see some of them.
So I have learned this in the ICU that there is this strong connection between sleep apnea and stroke, but that was a brand new thought and it took a while to make all the connections. So if somebody is told you probably have sleep apnea and it probably caused your stroke, they're probably not going to understand that. So what's the connection?
Right. So when we just look at purely numbers, people who've had stroke are 4 times more likely than people who haven't to have had sleep apnea. About half of our patients with stroke in the first month after their stroke will be positive for sleep apnea, and 90% of those will still have sleep apnea after. And I think a lot of the reason for it is like what is sleep apnea, and understanding that would help to understand why that correlation is there.
So you want to give us a description?
Yeah,
what is this mysterious sleep apnea?
So what sleep apnea is, there's 2 different kinds. Most of us think about what's called obstructive sleep apnea. And obstructive means obstruction.
So does that mean like your tongue falls in the back of your throat?
So that is part of it. There's also the back of your throat is made of soft tissue. And so when you're sleeping, all of your muscles, everything relaxes, and that can lead to that soft tissue kind of collapsing on itself or narrowing. The tongue can slide back. All of those things can make it harder for you to get air in through your nose or mouth and into your lungs. And that's the obstruction. There's a point here where there's a narrowing or collapse so that the air can't go past and you're having trouble getting air into your lungs. And that can lead to lower oxygen levels in your blood. And when that happens, then your brain is not getting oxygen that it needs. And over time, that can lead to, heart attacks and strokes and things like that, because you're just not getting the oxygen that you need overnight to the important parts of your body.
Could it also cause memory issues?
It can. So there's actually new data now that link sleep apnea to Alzheimer's and other types of dementia. So over time, it can cause problems with memory. And it might even in the short term cause brain fog. So you're feeling tired because you're not getting good rest overnight. And it can cause that kind of brain foggy feeling because you're not getting good rest and sleep.
Now, does it mean you have sleep apnea if you snore? Does everybody who snores have sleep apnea, like automatically?
Not always. So snoring doesn't mean that you have sleep apnea, and not snoring doesn't always mean that you don't have sleep apnea. But they do tend to go together because snoring happens when those soft tissues narrow and it causes that vibration when you breathe in. That's what causes that snoring sound. So it can go together, but not always. Not everyone who snores has sleep apnea.
And the only way to know you have sleep apnea is what?
It's a sleep study. So either one that was done at home or one that's done in our clinic at Norton's.
At home? You mean people don't have to come sleep in a strange office with somebody watching them all night?
Not always. We can do it at home if you are lower risk overall and we don't have other reasons to pull you into the clinic to do it. A home sleep study, you'd still have to spend the night with some equipment, but it's pretty minimal. There's a belt that goes around your chest, an oxygen probe on your finger, something that looks like an oxygen tube. It goes into your nose, and then you sleep with it and send it back, and then we usually have a good idea. It can underestimate sleep apnea, so if that comes back normal, your physician might ask you to do one in the clinic as well. But if it shows sleep apnea, then we can kind of go forward with treatment.
That's awesome. So I think I heard in a nursing education class recently that they've connected restless leg syndrome or like restless legs like syndrome to sleep apnea because their legs are deprived of oxygen during the night. Have you heard about that?
So yeah, you can have worsening restless leg symptoms if you do have untreated sleep apnea.
Okay.
And treating the sleep apnea can help to control those symptoms. You might still need medicines or things like that to control the symptoms, but it can be a symptom of sleep apnea.
Oh, okay. Does that mean you might not need medicine for the restless legs if the
I
sleep
have
apnea
several
was
patients who, once we've treated their sleep apnea, their restless legs got better and we didn't have to treat them.
Oh, that's great. I mean, I know a lot of people are like, any pill I can cut out would be great. So,
Yes.
well, how do we treat sleep apnea? You've brought a model with you. For those who are listening, she brought a mannequin head with her. And what is on this head for our listeners?
So this is a type of nasal mask that goes to our CPAP machines. For a lot of people, and for most people, the gold standard of treatment is still a CPAP. And most people think of really scary masks that fit over everything and are
A
very
Darth Vader
bulky.
mask?
Yeah. And, you know, it's actually recommended now to have a nasal interface, so something that either goes under the nose or maybe fits over the nose. It's been shown to be more comfortable, obviously, and also you can get away with less pressure on the machine. So this is usually where we start with treatment for most people. You'd have a mask with a hose, and this would go to a machine. And that machine is going to pressure air in to try and hold that back of the throat open while you're sleeping so it's not collapsing or narrowing. That way you can get good breaths overnight and sleep easy.
And then hopefully have more energy the next day, right?
Yes. So when you have sleep apnea, when your airway kind of collapses on itself, your brain will have to wake up your body to try and breathe again. So you might be waking up hundreds of times a night and not be aware of it. You might be aware of it a couple times, but many people with sleep apnea wake up a lot of times overnight and are just not aware of it.
What about people who wake up 8 times in the middle of the night to go to the bathroom?
A lot of that can be from sleep apnea. So part of what's happening when you have sleep apnea is that straining to open up the throat actually strains and puts pressure on your heart to kind of strain, open up when you're opening up your chest. And your heart feels like, well, there's too much fluid. I'm stretching because there must be too much fluid in my body, and tells your kidneys, okay, let's get rid of fluid. And so you actually have a diuretic effect from having the sleep apnea. And that might be causing some of your waking up in the middle of the night to use the restroom. Some of it is that you're waking up anyways because your body is waking up, and then you realize, wait, my bladder is full and now I need to go to the bathroom. But some of it is actually caused by the sleep apnea.
So the urinary urgency or frequency can be caused by the sleep apnea.
Yeah.
And then if you treat that, then those issues can go away too?
They can go away or at least get a lot better.
Yeah.
So you're not waking up nearly as much, not having to use the restroom as much in the middle of the night, and hopefully getting much more restful, good, deep sleep.
I have met a lot of people that would love to be able to sleep through the night. So if this could work for them, that's really exciting. Now, is this an option? You said you start with the nose masks for people most of the time.
Yes.
Is this one of those options for people who are more claustrophobic, or what would you say to someone who feels claustrophobic and wouldn't feel good wearing the mask?
This is what I recommend to see if we can try and start with something like this for people who feel claustrophobic. There are other options if it really doesn't work, depending on the type of sleep apnea you have and the severity. Some people can use dental devices, which are custom fit mouth guards that pull the lower jaw forward while you sleep to open up the back of the throat so that it's not narrowing or collapsing. And then there's kind of surgical types of devices. If you had more moderate or severe sleep apnea, you could talk with an ear, nose, throat doctor about something called Inspire, which is a implanted device. It goes into your chest, senses your breathing while you're sleeping, and then snakes up to your tongue and has your tongue move forward every time you breathe to open up the back of the throat. I don't love to jump to that until we've tried this, because this at least is not something that lives in your body, but those are good options for people who can't get used to it. If none of those other options are available to our patient, depending on the type of sleep apnea or their severity, then we can try and do something called desensitization with this mask, which is where you just try and use it during the day for a few minutes at a time. Start with a couple minutes, put it on during the day when you're not trying to fall asleep. Then the next day, make it 10 minutes, then 15 minutes, 20 minutes, to the point where it's like, if you wear glasses, you know that you don't notice glasses on your face after a while. We want to get you to that point with this before you even try to sleep with it, if it's really going to be something that you're struggling with. But usually we can get people used to it.
with strategies like that. That's
Mhm.
really helpful. And so I really appreciate how much time you're taking to explain this. And I've heard from other nurses that you're really good at explaining this to people. And so many times I feel like when people are learning about these new medical concepts and here's this medical device, go use it, they're like, well, I don't know what to do with it. So I appreciate you taking the time to really go through um, what works and why it works and troubleshoot when people are having issues and not jump to invasive things like surgery if it's
Yeah.
not absolutely necessary. Now, you mentioned a mouth guard
Mhm.
option. Is that something people go to their pulmonologist or their dentist for?
So you would start with us because you need a sleep study, or at least someone who can do a sleep study for you. And then you can take that to your dentist. There are dentists that there's a dental board of sleep medicine
Oh,
that's board certifies dentists for this. And they can custom fit mouth guards that will pull your jaw forward while you sleep. Generally, medical insurance is what they can take to pay for it. So that would be your medical insurance, not your dental insurance that would pay for it.
oh, that's interesting. That's a good tip too. That
Yeah.
way people aren't hung up on
On the
dental
insurance part of
insurance. Why
it.
are you not paying for this?
Yeah.
Because that's not their area. Okay.
Mhm.
Well, that's pretty interesting. So, are there any other frequently asked questions that you get that you'd like to go ahead and give our listeners the answer to?
A lot of people worry about maintaining their machine. There is cleaning that is required. So any part that touches your face, you want to wipe down once a day. The rest of it, about once a week or once every 2 weeks, you want to clean with soap and water. There are filters that are part of the machine that you'll change out every month. And then your supplier company will work with you on making sure you're getting replacement supplies as needed. So replacement on the headgear, replacement on the cushions and the hoses, because they tend to wear down over time, and you want to make sure you're replacing them regularly.
Yes. I know I get it set up on auto ship,
Yeah,
and that's been very helpful. Um, I think we might need to circle back to
sure.
the connection to stroke
Yeah.
and how sleep apnea acts in your body to make you more likely to have a stroke specifically.
hmm
Can you explain some of that physiology?
Yeah. So, like I said, when you have sleep apnea over time, that means your oxygen levels might be dropping in the middle of the night. So, you're not getting good oxygen flow to your brain and to other parts of your body. It also leads to stress hormone response in the middle of the night and disrupted sleep. All of those things put together give you that increased risk of both cardiovascular disease and strokes.
So, heart attacks and
hmm
strokes
Yeah.
and high blood
High blood
pressure,
pressure. It can lead to abnormal heart rhythms,
like
dementia,
like atrial
like
fibrillation.
atrial fibrillation, and that can help be part of the reason that you might be at increased risk of stroke. It can also lead to just confusion and memory issues and Alzheimer's even.
Am I making the right connection that then also the frequent urination caused in some people could lead to strokes from dehydration? Or is that too much of a stretch,
I'm
maybe?
not sure about
I'm
that
not
one.
sure
We'd
about
have to
that
look
one.
into that
Yeah,
one
may
more.
need to do more research. Okay, I was just trying to follow that train of thought.
Yeah. It's more, I think, the inflammatory response in the middle of the night that gives you
Okay,
that increased risk.
okay. Well, great. Well, I really appreciate you taking this time to explain all this because I know it can be really daunting and
Yeah.
challenging for someone to decide, do I even want to make this appointment to have a talk about a sleep study if I don't want to do this? It really is important though, and it really can prevent stroke. And like she said, reduce your need for certain medications. Oh, that's another thing that I'd like to mention is, for a lot of people with high blood pressure, they may be on several different
hmm
types of blood pressure medications.
Yes.
And I think I've heard them described as intractable to
Yes.
medical
Yes.
intervention that way. So, could it help reduce the amount of
It
hypertension
can.
medicine they need?
Based on studies, this is about the equivalent of one medicine for your high blood pressure. So the hope
Oh,
is that if you are on 3 medicines, maybe you could come back down to two. But it is helpful in controlling your high blood pressure. Um, as well as I just wanted to mention after stroke, there is some data that using a CPAP, if you have sleep apnea after a stroke, can prevent or can improve your functional outcomes. So improve your ability to get back to yourself. And that's a big reason for after stroke why a CPAP or getting a sleep study is a really good idea.
Yeah, that as well as just making sure it wasn't one of the initial causes, right? Because with our modifiable risk factors, we want to address all of them that we can, because those are the factors we can take a step towards preventing another stroke. So if this was contributing in any way to you having a stroke in the first place, then eliminating that as a potential cause of another one would be a great safety mechanism. So, well, thank you. This was so great, and I really appreciate you coming, Dr. Chandiramani. So if you have had a stroke and you've never had a sleep study, look up a pulmonologist around you, wherever you might be. You're with the
Norton Pulmonary Specialists. I want to say it's not just pulmonologists.
Okay.
Neurologists are also do sleep, so you can find anyone who's a sleep specialist.
A dentist?
Not quite, not dentists. I would say
there are
medical.
no dentists that do the sleep studies.
I don't believe so. There might be someone that has someone they work with, but I would find a medical specialist in sleep. So there are neurologists, there are pulmonologists, there's internists who've all done sleep training and can do this for you.
Do you think it would be helpful for them to Google sleep study near me?
Yeah, that could work.
Narrow it down to all the different specialists.
Sleep doctors near me.
Sleep doctors near me. Okay, that's what you get to Google. So, all right. Well, thank you so much. And stay tuned for the next episode of the Stronger After Stroke podcast. Like and subscribe, and leave any more questions you have in the comments, and we'll try to address those in future episodes.
Thank you. Thank you.